Okay.
I'll give you your number before we go tonight.
Yeah, I have, I think it's next.
Okay, at 6 o'clock, so we'll call a meeting of the Waushara County Board of Supervisors to order. We'll start out with roll call. Okay, thank you. Everybody's here except for Mike. Then we'll stand for a silent prayer and pledge of allegiance.
Allegiance to the flag, States of America, republic for which it stands, one nation, under God, indivisible, liberty and justice for all.
All right, I would look for a motion then to approve the agenda. Motion by Brandon, second by Dave Bossard. Any discussion? All in favor?
Aye.
Opposed? Okay, approval of the minutes of the April 18th, 2023 monthly meeting.
Motion to approve.
Okay, motion by Bob, second by Brandon. Is there any discussion? All in favor?
Aye.
Opposed? Okay, we did not have any public comment. Nobody signed up for public comment. No unfinished business. We'll move into new business. Reports and presentations. First is a Mental Health Awareness Month presentation by Department of Human Services Director Clara Voigtlander.
Good evening. I'm Clara Voigtlander, Director of Human Services. I'm here tonight, though, on behalf of a work group that we have developed as an extension of the recruitment, hiring, onboarding, and retention group. This is a group that was tasked by the executive committee of doing some follow-up from a satisfaction survey that was sent out to all county employees about 2 years ago. Amongst the findings of that survey, one of them was that employees were hopeful that Waushara County would feel like a place of employment that was invested in their mental health and their well-being. So this group is now, as a part of that, tasked with looking at what is in our employees' best interest in terms of mental health and well-being. How do we best respond to employees who may have mental health needs? And I would just share that we are not attempting in any way to be a replacement or a replica of our EAP program. We're not trying to infringe upon people's privacy or confidentiality, but just that we're a work group that's focused on looking at what options are available within our county and how we can best support our staff. So tonight, I just wanted to share a few minutes about the month of May. May is National Mental Health Awareness Month, so we're taking advantage of this month to do some activities geared towards promoting, reducing mental health stigma and responding to that survey response from staff that they'd like this to be a place of employment that is more supportive of that. So just wanted to share that our committee is made up of myself, Al Lucchini, Debbie Pavla, Jennifer Ward, Terry Billington, and Jennifer Weiss. So we have people from multiple departments and multiple different positions here who are speaking on behalf of staff. Some of the things that we're doing this month is using every Monday to initiate a new activity. We're focusing on physical health and well-being, coping activities, expressions of gratitude. This week was on mindfulness, so we've been sharing resources for staff on mindfulness and meditation, ways to express gratitude and feel thankful for the things that we have in our life. I don't know if any of you noticed on the way in, but on your way out, you should certainly look that on the table in the entryway, there's a gratitude station that we have started where staff are able to post things they feel grateful for or gratitude towards other staff. We also had an opportunity to include staff in wearing green. Green is the color that represents Mental Health Awareness Month, and Mary was kind enough to come and take a picture for us that was in the Argus just to kick off this month. This coming Monday, we will be using the lunch hour for staff to gather on the front lawn here, and we'll be doing a mental health walk for that half-hour lunch break around the courthouse. Again, just a nice opportunity to pull staff together and do something collectively, as well as recognizing this month. Some of the other things that we're doing on a larger scale include working to pull together a debrief team. This is something we've been working on for a few months, and we're really pleased that we've been able to kick it off and do debriefs, which are responses to traumatic events that first responders have experienced. We've been able to now do a debrief for the Potomac Fire Department and also one for the Poisippi Fire Department. And that's been really wonderful. So some of our efforts are also serving as an extension and a way to support our community partners, not just our employees, but the other people in our community who help support our efforts here. I also wanted to add that while we are not responsible or have any authority over any policy change, we do try to be a bridge of communication between staff and human resources about policies or initiatives that could be supportive of staff, one of which was the recent change that I thank the board for recognizing a funeral leave versus bereavement leave. So that would just be an example of, again, we don't have the authority to make that change, but we certainly can be on some level of voice for what's best for staff. We know that happy staff mean productive staff and efficient staff. So that is what we're most invested in. And just wanted to share with you tonight that that's something that we've been working on, again, as an extension of that work group that the executive committee had asked to take place after that satisfaction survey. And we'll certainly keep you updated if there's other initiatives that we take on and that we're finding success with, and always welcome input if the county board has any input on things that we should be looking at as well. So thank you.
Does anybody have any questions for Clara? Okay, that's very gratifying that you're doing that. I'm glad.
Yes.
It's nice. It's sometimes a group that gets overlooked as your own people, and I'm glad we're doing that. So thank you, Clara.
Yeah,
Appreciate
thank
it.
you. Have a nice night.
Okay, and now we'll move into the Finance Department Annual Report with the Finance Director, Sarah Lucchini.
So I promise not to bore you guys with numbers. I don't actually have numbers yet. Our audit was just last week, and they are also coming back in June. So I didn't want to provide any numbers that may or may not change between now and then and cause any unnecessary confusion. But Melissa had just asked that I give you guys kind of an update of what finance has been up to in the last year. So I don't know if you guys recall, but we bought Tyler Munis. Last year we went live in June. It's kind of been a big undertaking, a rather large undertaking. We kind of became computer software programmers that we weren't necessarily intending to be. But you guys were very grateful and gave us an opportunity to head down to San Antonio last week to attend the Tyler Connect conference. And we were actually able to work with over 5,000 other Tyler user groups that use the financial software system. And they had over 600 of their staff on site. So Melissa, Barry, myself, and our county treasurer, Jessica, were all able to attend, and we divided ourselves amongst different duties to try and get the most out of the conference. So Melissa had focused on like HR and payroll. I obviously focused on the finance end, Barry focused on the IT end, and then Jessica focused on like our cash receipting program, which multiple users use. And we had our sessions that we were able to sign up for. So I did some budgeting sessions, some accounts receivable general billing sessions. We learned tips and tricks. And Jessica and I also attended 2 leadership courses while we were there as well. So it was very beneficial. It was nice to know that some of the things that we experienced were also some of the things that others experienced, but it was also valuable that I no longer feel maybe at the bottom, like I was actually able to provide some of the things like the experiences and the expertise that I've now learned with the program. So we thank you guys very much for allowing us to do that. This is an annual conference that they have, so we hope to be able to go in the future, and perhaps once we go live with payroll, add in like an HR person to attend. So it's not always the same people attending, but so that multiple people from here are able to get the most out of that experience. And then just another thing that we've done since we've implemented Tyler is because it's it wasn't just one module at a time. We kind of bit off everything in order to do it. I've implemented monthly financial meetings with all the fiscal staff and or department heads are welcome to attend so that we pick a different topic each month. So we go over reports, or we go over the cash receipting modules, or we go over the budgeting modules to give departments kind of either step-by-step instructions on how to do it, or they're able to kind of have an open forum to bounce ideas off of others, like, what have you found that works? Well, we do this, or somebody didn't know that you could do it this way or that way. So we have been hosting those monthly meetings. Actually, in the month of June, it will be a full training on budget going into the budget season. And then we'll continue those. And my eventual goal is to switch gears off of Tyler once we're all a little bit more comfortable, and just do some more collaboration amongst departments, some more cross training, so that if somebody's doing something in a department and so is somebody else, maybe this person doesn't have a lot of time to work on that, but this person has some downtime, they can help assist, just kind of learning the ins and outs. And also, I think it would be beneficial that as people, if they choose to leave or they retire, that we have some sort of cross-training developed. So it's not all of a sudden we have a position vacant for 3 months and then you're getting a new person and setting that person up for failure. We've been getting the duties done because sometimes that's not happening right now. So that's really kind of what we've been up to in the last year, on top of doing all of the regular day-to-day duties. And then, believe it or not, even though I'm still focusing on 2022 numbers and doing day-to-day for 2023, we've already started prepping for 2024. So just to kind of give you a little bit of an overview of that timeline, in March, we already started working with departments on any sort of reclassifications or new positions that they may potentially need. Those will actually be coming to you guys in June. Our salary worksheets will be going out to the departments in June. And then in July is when they'll start working on the capital improvement plan and getting all of their budget figures together. Those are then turned in. And in the month of August, Melissa and I meet with every single department to go over those budget requests. And then we present that to you guys in September. And you come back with questions in October, and we pass the budget in November. So that's kind of what we've been up to in a nutshell.
Very good. Anybody have any questions for Sarah? Glad to hear the training was beneficial. I haven't talked to the rest, but except for Barry, and he echoed what you said, it was very beneficial. So glad to hear that. So
Thank you.
good. Thank you, Sarah. Okay, Department of Aging Services Annual Report with Director Debbie Pavla.
Okay, I can do the $1.5 million budget, but figuring these kind of things out, right? Okay, I think I have it. All right. Well, it's going to be back here to talk about the past year that we've had in the Department of Aging. Some of the primary effort, I know nobody wants to hear the word pandemic, and I really didn't want to have to say it, but really, when you look at 2022, the first part of the year, January through August, was really still we were really still affected by the pandemic. We had literally every single week between January and the end of August, we had some staff person out because of the pandemic, whether it was our drivers or, internal staff or, our volunteer drivers, key volunteers. So it was a huge impact, and it was hard for us. It's really hard to keep our functions going when we're short on staff. Hiring was still a challenge that did even out during the fall months, and we are at almost full capacity. We have been still unable to hire a kitchen assistant and a Wild Rose Dining Center manager. We've had those open for probably close to 8 months now for both of them. The dining centers continue to operate on a limited basis, and that was a much longer delay than anticipated. We continued to deliver meals 3 days versus 5 days, and there are challenges related to that. And the biggest one was raw food costs, as you all know, from going to the grocery store. For us, it increased 13.63% from the prior year, which equated to just over $15,000. Yeah. So that was a good thing we had the ARPA money that we had. Otherwise, we would have been in a bind there. So Sarah mentioned the financial component. Oh, I suppose I should click this along here. Sarah mentioned about the financial program, Tyler, and we had our challenges last year because of that, learning the new system, transitioning to the new system, but also at the state level, they had a long-term COVID-related illness, and all of our financials were delayed for close to 5 months. And that was a huge obstacle for us because we were at the very end of 2022 and really into 2023 and trying to go back in time and do about 5 to 6 months worth of financial reporting. Our financial reporting in our department is probably a lot different than a lot of departments because we have to we're not just reporting financial numbers, we're tying that to our activity. So any Older Americans Act unit of service that we do, we have to tie it to an expense when we report. So it's very, very much in real time when you're reporting, and it's very detailed. So it was a challenge. Plus, we had lost our long-term person who had helped a lot in our financial area and had a new hire there. And that's why it's so important that we have good retention systems in place, because anytime you have to hire a new person, it's a lot of extra work and very time consuming. So that was just a big part of 2022 for us. So I decided to add it onto the report. But some project highlights that we were able to take care of in 2022. Of course, we completed the planning and design input for the Poisippi Center and the Government Center. And earlier on in 2022, when the Government Center was being designed, I don't know if you all realized, but if you remember, we have the stairwell in the middle of the building when you first walk in. Well, at one point in time, they decided to move the stairwell and put it on the right-hand side when you first walk in, and that was right where our department is. So we had to redesign our first design, and then you all decided to move it back to the center, and so we had to redesign again, and then thought we had a good plan. And next thing you know, I was told that there was a big structural beam that came right in the middle of one of our offices, and we had to redesign a third or fourth time. So, but we actually have a really good design, so we're really excited about that. And we're really excited about Poisippi, which is ready to move into soon. So that was fun to participate in as well. And if you remember, in November of 2021, we took in-house the minibus and home delivered meal driver programs from Wishart Industries. So we spent a lot of time in 2022 establishing process and procedure related to those programs. We had a very strong emphasis on coordination of services, and we were able to come in under our contracted services budget this past year. So we were excited about that. We also reviewed the fee process for transportation, which was quite a larger undertaking than I thought it would be. But we've increased our fees, or maybe, we've increased our fees, and we think that it's enough to possibly offset what we might have to increase our budget for 2024. So other things is we redesigned the caregiver support group to a wellness and training focus, which really helped to increase participation. Partner with Wisconsin Parkinson's Association to promote and provide a Parkinson's support group. Partnered with Independent Living Options to offer classes on using technology, and that was a big request across the county to try to help people with that, especially our older adults. And we increased partnerships for assistance with spring and fall raking and cleanup for those in need, and doubled our participants served there. So we were excited about that. And one of our big focuses in 2022 was social isolation and the awareness just about the issue and how significant it can impact people's health. And then the identification process. How do we go about identifying people who are socially isolated? And then what do we do about that once we identify them? How do we get them connected? So some of the things, we have an ad hoc committee that has met 2 or 3 times now, which includes members of the community, some business members. Mary is on the committee, and others. and then citizens and, a wide spectrum of people who have provided input into the process and into what is needed. We've created a senior connections booklet to help people be aware of how they can get connected with one another. We're working with the Chamber of Commerce on some welcome packets for specifically to the older adult population. So when they move into our area, they can get connected with others. Reinventing the Friendly Caller program. It's being enhanced some in the Friendly Visitor program. We've already talked about, well, the screening process, like how do we identify people? We're incorporating that into our home delivered meals assessment program so that we can ask some key questions and hopefully reach out at least to that population group. And then we've enhanced some activities. So this social isolation is a big issue. It's not anything that the Department of Aging can solve on its own, but we can at least create awareness and try to do some things, and especially that screening piece when we identify those people who are really reaching out and letting us know that they are lonely or possibly depressed, and then what do we do about that? Looking at some data highlights for 2022. I'm not going to go through all of these in great detail, but we did serve 41,708 meals. That was a 16% increase from the year previous. The rest of the data is pretty close to what it was in 2021. The number of trips and our ADRC contacts for the consortia, right around 9,600. 591 contacts related to disability benefit assistance and 340 elder benefit specialist cases that resulted in over $1 million in monetary impact, and 77 Waushara County residents participated in health promotion program activity. We assisted 100 individuals with caregiver support, provided foot care assistance to 60 individuals, provided chore assistance to 30, routine visitor calls to 44 individuals, and utilized 163 volunteers for over 4,000 hours of service. I always like that one. That's a huge commitment for those volunteers, and it's greatly appreciated. We are required to document every unit of service that we provide under Older Americans Act. And in 2022, we had 56,575 units of service. We also perform what we call non-Older Americans Act activity. So we document that as well. But it's those 56,575 units of Older Americans Act program activity that has to be tied to the financial reporting when that's reported out. Our services that we provide each year, each day is about 225 units of service per business day. So we're open 251 days a year. And we also get about 50 or more calls daily, and that hasn't really changed a lot from the last couple of years. A quick look at the budget, just over $1.5 million was our total 2022 expense. 41% of that was from grants, 28% from purchase of service, MA claiming or program donations, 23% county levy, and 8% indirect expense. We put indirect expense into our budget where a lot of departments may not do that, but we do that so that we can draw down a larger amount through our MA claiming process so that it brings in more money to help support the services. Priorities for 2023. I'm really excited about moving into the Poisippi building. That's going to be happening. We're packing things up now, going on Friday and getting those boxes put together. And then going to move some things in the following week. We hope if everything goes well, that we'll serve our first meal there on June 5th. That will be to those regular and routine participants that come, and then we will open up to more the general 60 plus population on June 6th. So I want to tell you that when we provided the opportunity for our Poisippi Dining Center manager to walk through the Poisippi Dining Center, she was just ecstatic. She could not believe how beautiful it was. She actually was teared up a little bit, and I don't think I've ever seen her smile as much as she smiled that day. So she is really excited. The participants are really excited. The big 70-inch TV seems to be the big hit. So they're not sure how this Wii bowling is going to work on such a large TV. So, so we're looking forward to it. In the process of planning that grand opening and ribbon cutting ceremony event, and have details about that pretty soon. Looking to do that hopefully the week of June 19th. Other priorities for 2023. So you all know that the health emergency ended in May 11th. Well, we're still in May, but on May 11th, I believe. So our home delivered meal process for eligibility was different under the health declaration for the pandemic. And now once that's ended, we have to reassess everybody, and the criteria goes back to the pre-pandemic guidelines. So that's a huge task that we're going to take on. It will take us probably 4 to 5 months to get everybody reassessed. And there may be some people who no longer qualify for the program, and that will be the hardest part, is letting them know that they are no longer eligible and that they could attend a dining center instead. Oh, let's see here. Rebuilding the dining center program. So we still don't have all of our dining centers back to their pre-pandemic number of days that they were opened. And honestly, I don't think we ever will have all of them back. Some of them no longer want to go back to 5 days a week, and that's okay if they don't want that. So we're going through that assessment process right now as well to determine what each community wants for their dining center program. And then determining meal delivery 3 versus 5 days a week. The Commission on Aging has talked about that quite a bit. There is a savings to delivering 3 days a week, but there is a larger hardship on the kitchen and some hiring and things like that. So it's a balance that we're looking for there, and trying to decide which way to go moving forward. A few more things, strategies to help meet employment. Transportation needs has been a big discussion for us for the last few months in our transportation committee. When you always, no matter what meeting I go to, we always hear that transportation is a big issue in our county, and we're trying to really get specific about that. What does that really, really mean? And it really comes down to 2 things, in my opinion. There's probably more, but the 2 highest needs are related to transportation for people to employment when it's during the business week as well, because we can't serve everybody in all areas every day of the week, but primarily after hours. So those people that are working until 6, 7, 8, 9 o'clock in the evening, there really is no option or very limited option for them. And then the weekend transportation for employment as well. And then the other area need related to transportation, I would say, is that on demand. They really just want to be able to pick up a phone and call somebody when they need it, no matter what time of the day or night, and have that transportation available. And that's really hard to provide because it's limited usage, and how do you pay for somebody to be on call 24/7? So I always say, if transportation were easy to figure out, we would have figured it out a long, long time ago. So it's a very challenging program. We will be applying for some additional grant funds. This will be the first time this year that we will be responsible for submitting what we call a 5310 application, and that's for our vehicles that we use for the minibus program. And then we're looking at some additional new grants to help support some of our programs and services. We have a goal in our aging unit plan to look at somehow enhancing affordable options for at-home support assistance. So this might include increasing opportunities for raking, grass cutting, snow removal. We get a lot of calls from older adults who just need help moving something from one location to another, maybe taking their outdoor furniture inside or whatever. So things like that, just help people stay in their own home for as long as possible. And then, as you all know from watching the news, that these darn scams just will not go away. And it's really a challenge, and people just buy into it sometime. And so we're trying to do as much as we can to educate our folks about that. And then we'll continue to work on those social isolation prevention strategies. So always lots to do. And I really know that I feel that This board is very supportive of our programs and services, so I just want to make sure you know that and to say thank you for that support. Any questions?
Yep, Mark?
Yeah, but I just want to tell you that your people not only deliver meals, they check on the people.
Yeah,
And my mother had a spell last week.
I'm
And the
sorry.
driver found her and your office called me and my brother and I turned around and got out there. He would not leave until we got there. So I don't know who the driver was. Tell him thank you.
okay,
But your office does more than just delivers
Yeah.
meals.
yeah.
That's,
Thanks for saying that, Mark. Yeah, last year, actually, we talked about this at the Commission on Aging meeting. We, more than a couple of times, we found people in a not good situation. I don't know how your mother was, but where if we had not been there, that individual most likely would have died. We had one suicide attempt that we had intervened on. So, I mean, the drivers, the lowest paid on the scale, they do that work. And so I appreciate that you said that. I will. Yeah. And your mom's okay? Okay, good. She's not complaining about that chicken.
Debbie, you said that you served more meals, like 41,000 this year, more than last year. How is it compared to like pre-pandemic?
Pre-pandemic.
And
yeah.
how is it, have you projected out like into the future? Is it going to grow or what?
Yeah, I definitely think we're going to go up. We'll probably go into that, let's say like 45 to 47,000 range. It really depends on the dining centers at this point, I think, and how many days each of the sites are open and where that balances out. So pre-pandemic, we were in the, I want to say we were in somewhere between 46 and 48,000 meals. So.
Any other questions then for Debbie? Well, thank you very much for your hard work. We appreciate it. You bet. Okay, we'll move on then to discussion and possible action items. Number one is the replacement of the jail plumbing controls and valves. Ruth?
How do you like that? Now it's the Ruth show for the rest of the
That's
meeting,
right, yeah.
okay? I know you guys have missed me, so I told everybody else they didn't have to come, that I would talk for all of them. Okay, so as part of the building project and going around and looking at the different buildings, we started talking, and I think most of you know, we started talking about some of our maintenance issues in our existing buildings and how we needed to come up with a better plan to do preventative maintenance versus, oh my God, we need to fix this now, so that we can kind of keep doing that. So we've been working with the Buildings and Grounds Committee for the last couple of months, trying to come up with a good plan and looking at what the priorities are. And one of the things that the Buildings and Grounds Committee had determined should be a priority is replacing jail plumbing controls and valves. Because Buildings and Grounds staff are spending a lot of time at the jail, turning off water to fix leaks, to replace different pieces, because after 20 years, they're starting to go bad. I mean, these are pipes and things that are being used 24 hours a day, 7 days a week, 365 days a year, right? Plus, sometimes we don't have the best boarders, and so they tend to do damage to some of our systems as well. And so what we had been looking at was, we have Acorn parts right now. So we looked at Acorn parts and Icon parts, and the Icon parts were actually cheaper, and it is less mechanical and more technology. So it can be set up so that you can turn off certain cells, even down to a cell or a cell block, so that things can be fixed in certain areas. Or if you have one of our not so nice boarders, we can turn off the water if they're misabusing it, kind of thing. All within jail regulations, of course. We would never violate anybody's rights. But so a lot of it has to do with technology and software. But so the Buildings and Grounds Committee has asked that this be one of the priorities. The bid that we had to replace the full system was about $498,000. Since that time, today, actually, we got a bid for a part of it for the plumbing piece. Went to $339,000, but that does not include some of the electrical that would need to be done for to put in the antennas for the systems to talk to each other. And some of the ducts and the dust and cleaning out and while you're doing it, and temporary barriers and things like that. So what I'm here to ask today, because I don't have an exact number, is that you would authorize us to spend up to $498,000 of ARPA money, and we do still have that much money in ARPA money, to replace these jail control modules. And then we have the final number. Of course, we'll bring that back, and we hope that we will not have to use all of that, and then we would still have some more ARPA money left for other things. Currently, we have $642,000 that's not allocated in our ARPA fund.
Yeah, and I've read too that there was like the electrical portion and maybe Kurt, if you want to comment on that as well, but there's that cost, I don't think would exceed this. It didn't appear, they didn't give us numbers, but
We did not, and Ben is going to have one of the electricians who's worked out at the jail before come and look at it, and then another individual. He does not believe that it will cost the whole $150,000, that this part
Cents.
came in less.
Mhm.
So I think that we will come in under that. But this bid is good for 30 days. So instead of waiting until next month, which we certainly can if that's what you choose when we'd have stronger numbers, I'm just asking for a not to exceed number so that we can move forward as we get the numbers.
okay.
Make a motion to approve.
Okay, motion for 498,000, not to exceed 498,000. Is that it, Brandon? Okay, and a second by Eckstein. Is there any discussion? Okay, now this is coming out of ARPA funds, so you all know. All right, let's proceed to vote.
Take a go.
Okay, it passes. All right, now we'll move into item 2, pausing the Emergency Operations Center and the Evidence Maintenance Garage projects.
So as you know, when you came back, almost a year ago, I guess it was, to increase the bonding amount, included in that increased amount was the EOC and the Evidence Garage, Maintenance Garage / projects. As we are moving along and we have multiple fires going and different things are coming up, and we've been using some of our contingency fund. Either some things were missed or some things needed to be changed for whatever reason. Buildings and Grounds also had talked about this, not necessarily saying we no longer want to do it, but because there still is like a need, but saying, hey, let's put this on hold for right now. Let's finish what we've started and see how much money we have left and then go from there. But because the county board approved that full plan, we need to have, it's best if you guys also would approve putting this on hold. So I'm not asking you to cancel these projects. I'm asking you just to stop, take a breath, wait till we finish some of the projects before we move forward, because the last thing I want to do is come to you and say, okay, well, the garage is built now and the EOC is built, but guess what? I can't finish this in the government center because that's the last one that would be completed. So I don't want to come back and ask you for more money. So I'm asking you just to take a break for a second.
Okay, and that was, I think the plan was that we'd revisit it like this fall. Isn't
Yep.
that right? Is that what you're thinking, Kurt? And then we can see where we're at and if we're able to move on from there. So, okay,
Motion to approve.
motion.
Hold.
Okay, motion by Brendan, second by Bart. Is there any discussion on on this? Okay, seeing none, we'll proceed to vote on that.
Yes.
Okay, and that motion passes. All right, the Barbola Funeral Home claim.
So, in June of last year, I know you all got the memo, so I'm not going to read it for you word for word, but basically, we had an ambulance that was running in Poisippi unattended in park, came out of park while it was unattended, went across a street, luckily did not hit a car or a person, and hit Barbola's funeral home, causing damage. It was submitted to our insurance company. Our insurance company has not declined it, but they also have not approved it. And they are now attempting to get Ford to say it's their liability. Our ambulance is still in operation. It has been to multiple dealerships. It's been to our highway shop. It does not have a recall. We can't find anything wrong with it. I get it, insurance adjusters' jobs are to find reasons not to have to pay claims, right? But in the same sense, I have a hard time saying that we're not responsible, because certainly Mr. Barbola did not move his funeral home out in front of our moving vehicle. And so what the executive committee, public safety, I think it went to public safety this last month, is asked that we come to the county board, because any claim over $5,000, if we are going to write a check out of the county money for it, has to be approved by county board. So we are here to ask you if we can pay Mr. Barbola his claim while we continue to fight with our insurance company, because it has now been 11 months and nothing has happened.
And maybe part of that motion could be too, that we look for a different insurance company for another year because of their lack of effort on this, so.
Make that motion, Mr. Chairman.
Okay, motion by Bob, is there a second? Second by Eckstein. Any discussion? Okay, and this will come just out of the general fund?
Yes.
Okay. We'll proceed to vote.
Right, yes.
Okay, the motion passes. Very
Thank
good.
you.
Okay, the amendments of the county board bylaws.
So you got the packet. I know there's one typo. Thank you, Mr. Piaski. Sometimes my brain sees what my head says it's supposed to say, especially on words that spell check actually recognizes as real words. Does anybody have any questions? The biggest change in it was, this came about, one of our CCS-CSP program has to have, by our state standards, has to have certain number of meetings per year in order to show that we're meeting our requirements. And the advisory committee that was in charge of that has not been able to get a quorum, so we had to switch them to a different committee. And then we started looking at it, and the Human Services Board, when Human Services became Human Services, when we combined the Department of Community Programs and the Department of Social Services back in like 1999, 2000, they had a set of bylaws that then developed different programs, and it took on some of the committees that were existing at the time because they were required by statute for a Department of Community Programs. With the Department of Human Services, they are not required by statute because the statute says the Human Services Board is some of those things. So we started looking at it. And so like the biggest changes you'll see is like taking out some of those advisory committees for the Department of Human Services because they will just be under the Department of the Human Services Board and not necessarily under the county board. Then the other ones, we are no longer part of East Central. We went away from that, so taking that out. And I think there was a couple of places where it still said administrative coordinator needed to be changed, a couple places where it still referenced the personnel committee, which we no longer have because we combined it with the executive committee. So a lot of it was just cleanup, not really changing anything unless anybody had any questions.
Okay, motion by Bonfiglio. Is there a second?
Second.
Second by Waddle. Is there any discussion?
Was that typo, the one on page 15?
Well, let me see.
Better not be a second typo in there.
There might be. Oh, if there is, Can I-
Cancel it.
can I be fired? Yes, it is the one on page 15. Damn. Thought I had two mistakes.
Okay, with that, then we'll, any other discussion?
I just had a question with that CJCC.
Yeah.
So that committee still exists. It's just determining who needs to be on the committee in the bylaws of the
Yes.
CJCC.
Yeah, because they also have their own bylaws by statute. And there used to be additional people on there. Mr. Cap is currently our county board rep on there. So it was just making this bylaw consistent with how the committee has been running.
Okay, yeah, there's a long list of people that got striked off of there. I wasn't sure if that if it covers that in the bylaws of the CJCC or
It still does call for a county board member to be on it, I think.
Yeah, okay, let me find that page and I can explain that better, just. So most of these people are all on there, but they are all in the CJCC bylaws as to who has to be, because we have changed it over the years to include one of our therapists. We've included someone from the health department. We've included different people as different roles come up. So the CJCC bylaws have been updated since this. So I thought that it would be easier to say that those bylaws would determine the people who had to be on it, except for the county board member, because these are your bylaws and we want to make sure that you know that there's at least one of you on that as well.
Okay, is that
Thank
clear?
you.
Good, okay. Any other questions on the bylaws? Okay, there's been a motion and a second, so we'll proceed to vote.
Yes.
Okay, the motion passes. Very good. Thank you, Ruth. Okay, now we'll move into consideration possible action on the following resolutions and ordinances. The resolution number 05-05-23, the resolution to reorganize the Emergency Medical Services Department, eliminating the full-time administrative assistant position. And we do have the EMS chief, Melvin, is online too, if somebody needs to, if any further explanation is needed, otherwise just to vote for.
Motion approved.
Okay, motion by Bonfiglio. Is there a second? Second by Piaski. Is there any discussion or questions? Okay, hearing none, we'll proceed to vote.
What? Yes. Okay.
Okay, and that resolution passes. All right, resolution number 06-06-23, resolution authorizing fund balance restrictions, commitments, assigns, and reappropriation of specified funds from 2022 to 2023. And this is, as you read, just to bring things forward that you may have been brought up by other county boards, but now they just have to be brought in. We have to approve them again, so.
Motion approved.
Okay, motion by Bonfiglio. Is there a second? Second by Peterson. Any discussion? Okay, we'll proceed to vote on that.
Yes.
Okay, and the resolution passes. Very good. Resolution number 07-07-23 requests State of Wisconsin to use a portion of the 2023 budget surplus for maintenance, repair, and replacement of county trunk highways. Is there a motion? Motion by Eckstein, second by Piaski. Any discussion? Okay, we'll proceed to vote on that.
Yes.
That resolution passes. Resolution number 08-05-23, resolution allowing Director of Parks to apply for trail aids under a state statute 23-09. Okay, motion by Eckstein. Is there a second? Second by Urban. Any discussion? Okay, we'll vote and proceed to vote on that.
Yes.
Okay, that resolution passes. Ordinance number 677, an ordinance amending Chapter 2, Article 1, Section 2 and 3, 2-3, Washare County Code, increase of overpayments and underpayment threshold. Does anybody want any explanation of that, or? It's not.
Yeah, what,
Oh, go ahead.
I wouldn't mind an explanation of
Okay.
what that's all about.
So right now, our ordinance says that if there is an underpayment, or an overpayment not exceeding $5, we don't have to issue a refund unless there's a written request for it. And as there is an underpayment of not more than $5, that we can just say we're not going to collect it because the cost of collecting exceeds that. Jessica had gone around and asked some other counties, and the other counties in our area have done that to $10 just because of the cost of writing checks and mailing things out to people. And then a lot of times you send them a check for $5.50 and it doesn't get cashed. And a year later, we're asking for those checks to be canceled. So it was just increasing that.
Okay,
Okay.
thanks.
Okay, motion by Bonfiglio. Is there a second? Second by Peterson. Any discussion? Okay, proceed to vote on your tablet.
Yes.
Okay, and that ordinance passes. Ordinance number 678, an ordinance amending Chapter 46, Article 1, Washare County Code, process for maintaining and selling tax delinquent property. So, you know, that's very expensive to keep that property on hand, so we're trying to move it along so we can get it sold quicker. So, okay, motion by Bonfiglio. Is there a second? Second by Peterson. Any discussion? Okay, we'll proceed to vote. Okay, very good. That ordinance passes as well. All right. These next ones we'll just do with a voice vote. The appointments, the Land, Water, and Education Committee, and that's for Sarah Stelter, FSA rep for Watoma, term April 23 through April of 26. And Chris Riley, he's the alternate FSA rep from Watoma, and his term would also be April of 23 through April of 26.
Motion to approve.
Motion by Waddle, second by Bonfiglio. Any discussion? All in favor?
Aye. Aye.
Opposed? All right, very good. Library Services Committee, Jewel Mucklin, Watoma, term May 2023 through May 2026. Is there a motion to approve? Motion by Bonfiglio. Is there a second? Second by Bossard. Any discussion? Okay, all in favor?
Aye.
Opposed? All right, it passes. Thank you. Proclamations, recognizing June 15th, 2023 as World Elder Abuse Awareness Day. Is there a motion? Motion by Bonfiglio, second by Eckstein. Any discussion? All in favor?
Aye.
Opposed? All right, very good. Thank you. And the only other thing is the board suggestions for future agenda items. Does anybody have anything?
Debbie, did they feed at the Poisippi place on Tuesday nights? Or could we host a county board meeting in that building? I don't know if it's like a rule against doing that, but it'd be nice if everyone could see it at the very least. Okay, can we do that? I don't know. Do we need to vote on that? Probably not. All right, we're meeting in Poisippi at
Well, we look at it. That's a good idea, Brandon. Sure. And I think part of it'll be how quickly we have internet.
Oh, sure.
Because there was some question, some of that was there. So, but when we do, that's a good idea to go over there and check that out.
Saves me 15 minutes of driving.
There you go. Think of yourself.
Make me drive 15 minutes longer.
Yeah.
I say 15 minutes.
Maybe
I know,
Pat,
but make-
maybe Pat will pick you up or something. Anybody else have anything for future agenda items? Okay, seeing none, motion to adjourn. Okay, is there a second? Second by Bonfiglio. Okay, we're adjourned. Thank you very much. Next time.
Oh, we're earlier that night.
Yeah.
You had to hang on for the ride-ins.
The
weather. Very much.
You have to pick me up.
Yeah. You can always. Well,
Quit work at noon.
down either.
Where things working out at
You did great.
the new owner.
Some of these are going so fast, it was like, how do you get ahead of them?
The only thing is to answer somebody else as far as where the
Oh,
bills.
what's new, Robert?
Thank you, Jacob.
You're welcome.
Yeah.
This is kind of interesting.
Yeah, it is. It's a good meeting because they're really